Hello. Today we're going to be discussing the use of a cervical roll to help improve sleeping positioning, sleeping posturing, and later we're going to discuss a roll for your lower back, the lumbar roll. This particular product is a McKenzie Cervical Roll. And the instances that I really like this is if people are telling me that they're waking up with either neck pain, or if you are someone with a nerve or disc related problem, you're not just having neck pain but also symptoms down one or both arms, I have found that this product can be very beneficial because nighttime is meant to be a time of rest, recuperation, and recovery. So, my logic is if you can sleep comfortably and allow your areas that are in pain or dysfunction to heal during the evening, your daytime will be better with significantly less neck pain, headaches, and or arm-related symptoms. So the first item I like to use is the cervical McKenzie roll. And we simply have taken it and modified it a little bit from its original use. I prefer to put it inside of a stockinette and then have the person gently tie it around their neck so that regardless of where your pillow goes at night, the roll will stay with you. It's very hard to give recommendations on pillows because we're all unique human beings. So I have found usually this works great with almost any pillow somebody has, but again, most importantly, it keeps the neck in a very nice neutral position. As you can see with Jessica, while it will allow her head to bend slightly to the right or to the left, it won't let her get into these extreme positions that many of us get into at night, which can compress the whole of the foramen that the nerve will exit and intensify or create more arm-related symptoms. Or if you happen to have a fairly degenerative neck with some arthritic changes, again, it limits the ability for those joints to compress at night. So the logic would be you're going to wake up feeling better, more refreshed, less of a headache, less neck pain. So as Jessica demonstrated, she was able to nicely tie it around her neck. And then we're going to have the person initially have them lay on their back. I think most of us know at this stage of the game that stomach sleeping is obviously not recommended for a variety of different reasons. But as you can see here with just a very thinner pillow, this is at least providing support for Jessica's neck from behind. But then I also like it for people who are side sleepers. So we'll have Jessica rotate to her left side. In this case, you'll need to possibly fold your pillow if it's fairly flat and allow Jessica's neck to rest and head to rest comfortably here. But the reality is, and I'm going to just exaggerate. If she didn't have that, sometimes the tendency, right, is for our head to really sink significantly further, which is going to compress that side of your neck that you might be having arm symptoms. With this cervical McKenzie roll in place, it just does a nice job of keeping your spine in neutral position. So next, Jessica and I are going to demonstrate the McKenzie lumbar roll. Important to know, it comes in different sizes, anything from extra small to extra large, so it can fit a variety of body types. But one of the things that you will tend to notice when it comes to lower back related problems, and a lot of clients will have symptoms at night that will either wake them, or if they're having leg related symptoms like sciatica, it might exacerbate their symptoms at night and they invariably cannot find a comfortable position to be in. Well, the same thing, and it tends to be a little bit more prevalent on women where you tend to have a narrower waist but a little bit wider at the pelvis. And if you happen to have a very flexible spine, when you go to lay down, especially on your back or your side, your spine might tend to shift at night. And again, we'll get back into that compressing the nerve tissue and some of the highly pain-sensitive structures in your spine. So by using the McKenzie lumbar roll, same concept as with the neck, we will put it around the individual's waist just above their pelvic bones. So we're going to try to take up some of the space between your rib cage and the top of your pelvic bone. And then in this case, again, since we tend to recommend either supine or sideline for a variety of back conditions, again, don't recommend laying in the prone or stomach position. So we'll now have the person like Jess lay on her left side. And then the beauty of the lumbar roll is that, again, it's taking up some of that space between her rib cage and her pelvis. So at night, her spine will not be able to shift towards the bed as much. And again, try to keep those facet joints and nerve run opening spaces open and patent with less compression all night long. This will also work well if someone lays on their back as well. And for some people, they tend to have, what we might call a hyperlordotic or an increased curvature in their lower back. And again, by snugging this down into here, it'll take up some of that space to provide support and help keep Jessica's spine in a more neutral and healthier position. So those would be some great recommendations to help you sleep better at night and as a result have a much better day. Thank you very much for tuning in.